Good afternoon, everybody, and thanks for being with us here for the news at 4:30. I'm Bill McGinty. The number of coronavirus cases here in the Carolinas is rising. At last check, there were more than 120 cases in North Carolina and 60 in South Carolina. That number expected to grow. Right now, we are waiting for a press conference from South Carolina Governor Henry McMaster and the state health officials in the Palmetto State. We will, of course, carry that live just as soon as it begins. In the meantime, here at WCNC, we are committed to bringing you all the facts and helping you make sense of all the latest headlines surrounding this deadly virus. We're also practicing social distancing. And for example, my co-anchor Vanessa, normally here in the studio with me, is doing her part of the show here from her home in uptown Charlotte. We're also joined by Dr. Anna Maria Temple, who is here to answer all of your questions about this virus. So, Doctor, let's begin with you. A lot of people still want to know what makes this virus so bad. I guess that's a matter of perspective and context, given maybe someone's age. If you're 83 versus 18, it might be worse, right?
Right, and it's so contagious because nobody has antibodies to this illness. It's never been seen before in humans, so nobody has developed antibodies. So it is spreading rapidly because nobody can defend themselves against it properly, and we just keep passing it along. Versus, let's say, like the flu that a lot of people have seen before, and they've developed antibodies, so it's more protected.
Okay, so we've heard the elderly are most vulnerable, so let me kind of script up a scenario for you. Let's say we have an elderly parent and we're taking them some food. We don't have any symptoms, but maybe somebody at work maybe has tested positive or at least has been tested. Is it okay to take food to mom or dad or grandma or anything like that? And how close to them can you get in their residence? This again, if you feel okay.
This is great. It's a conundrum, really, because you're feeling great, but you had somebody at work. So are you an asymptomatic carrier that are just bringing not only dinner, but you're also bringing the virus along with you? I usually say, I'm trying to say, me personally, I'm recommending that we stay away from our elderly parents as much as possible. And if you bring them dinner, leave it out there. They can take the dinner inside. They can put it in a different container and wash hands really well, and then enjoy the meal. As far as hanging out with them, that's really hard. I mean, we have mamas that are giving birth and they want their parents to see the baby, and then other kids. So there's all these social implications, which is making it really hard. And I would say if you're elderly parent, elderly grandparent, you really have to take into account their overall health, their overall lifestyle, and really what risks you putting everybody at, and there's no exact answer, which is why this is so concerning.
One quick follow-up to that thread there. So if you're in the room with somebody and you're not coughing, is that okay? These are questions we're getting.
Totally. So right now, all we know, the reason that you're doing the 6-foot distance is because so you don't spit on each other. Because when we're talking in normal conversation, spit comes out of your mouth and viral particles can live in spit. And so that makes it less likely for you to transmit it to somebody that you're in the same room with. Now, if you're coughing, the cough, the pressure, the force of the cough actually makes the virus go longer distances. And that's why we're trying to do at least 6 feet away from somebody else. So if you're asymptomatic, talking to somebody from 6 feet away, it is less likely that that transmission is going to happen. We're just going to have to make sure we are 6 feet away, and then after you leave, that they just do proper precautions. If you're hanging near a table or you've been talking over a counter, that everything gets wiped down because the virus can live on surfaces.
All right, let's bring Vanessa into the conversation. Vanessa,
right. Thank you
do you
for
have any
that.
questions?
Okay. Yeah, actually I do. This is actually coming from just some anecdotal information that I've been getting from relatives. I have a lot of relatives that are in the medical industry, and we're just getting some things from them saying they feel like they don't have enough personal protective gear, and it just kind of makes me wonder what kind of gear is necessary to interact with a patient with COVID-19. What is the typical lifespan for this gear? You know, during a typical work shift, how many times would you be changing this gear out? Do you have that information?
So, Doctor, were you able to hear Vanessa's question?
I did not hear anything.
Oh, okay. Sorry about
Unfortunately.
that.
No
All right,
worries.
Vanessa, I'm going to have to translate here. We've got a little bit of a technical difficulty there.
Take it.
All
Yeah,
right, so
take it.
her question was basically what kind of gear is necessary to interact with COVID-19 patients, and how often should the gear be changed out?
What's the
That
lifespan?
is a great question. We need the respirators, the N95 respirators that seal your mouth completely and seal every part of your face in order to not get the virus transmitted to your face. Really, you're going to have a shield, face shield, so it doesn't get into your eyes, because when people cough, they don't only cough into your face and your nose, but also into your eyes and then obviously on the skin. So having a face shield is really important. Gloves are really important, and really people work in the hospitals are going to have to wear gowns from head to toe because the virus particles can live on their clothing, so they need to put that on while treating folks with COVID-19. As far as how often you need to change that, it's generally, the rule is in between every patient.
All right, doctor, thanks very much. And we want to remind everybody, you can text us some of your questions. We're going to get back with the doctor here in a moment. Welcome back. All the information about the coronavirus can be taxing. There's so much out there, not only in cable news, newscasts, but certainly on the internet and in your Facebook feed. So we want to make sure that you're getting the factual information, talking to doctors and other experts about everything that you need to know. And there are a lot of misconceptions swirling around out there about this coronavirus. Dr. Anna Maria Temple and Vanessa joining me again. We're all practicing social distancing, as we should be in the workplace. But doctor, one big misconception out there is that taking elderberry serum or syrup boosts the immunity to fight the coronavirus. A lot of people believe in that year-round just to ward off colds and things like that. Is this true?
So the misconception that is out there is that taking elderberry syrup daily, or if you're infected with coronavirus, can put you at risk for severe disease, and in the specific case called cytokine storm. And this has not been shown anywhere in the literature. What has been shown is that when you have influenza and you take elderberry syrup, it increases your IL-6 and cytokine levels, which can be pro-inflammatory, so inflammation or against inflammation. And then so they looked at it, raised your IL-6 and cytokines, and then they looked at coronavirus. And coronavirus, when you're going into a severe issue, it's called a cytokine storm, which is started by IL-6, if you will, to make it like real simple. And so people are drawing a conclusion that if you raise IL-6 from elderberry syrup in influenza, that you're going to be put into a cytokine storm for COVID-19, which has not been shown, not proven. Fun fact, junk food and soda increases your IL-6. Fitness, so working out, increases your IL-6. So based on that conclusion, we should say we shouldn't do any of those things because it raises your risk factor. So at this point, the takeaway is this. There's no medical evidence to show that elderberry syrup puts you at risk for cytokine storm. But if you are nervous and worried, then use other berries. Use blueberries, blackberries, raspberries. If you've always taken elderberry syrup and it fits your body and it helps you stay well, you can continue doing so. However, be mindful that we are looking at a wild berry as being the problem, and we're ignoring the fact that junk food, soda, fast food are actually a huge problem, and a bigger problem that is depressing our immune system.
All right, doctor, great. Let me jump in with another question here. People who work at stores, let's just say grocery stores, maybe a Publix or a Harris Teeter. What precautions should those workers take when they go home? Because I know the grocery stores in the area are desperate to have people come in and work. So those people that are going into work, when they get home, what should they do? Should they do anything?
Yeah. Oh, first thing, leave your shoes at the door, change your clothes at the door, and wash your hands really well. And I would even wash my face. And another awesome tip is to have a nose spray, which is just saline. Have it right there where you wash your hands, and spray your nose, because the virus does not like to attach to a moist mucous membranes, which is in your nose. So if your nose is dry, it's more likely to attach and cause problems. So just like you wash your face, wash your nose out with normal saline to decrease your risk of getting this.
All right, Vanessa?
All right, yeah, Dr. Temple, I did want to ask because I feel like there's a misconception when we hear the term, social distancing or even self-quarantine, that maybe we can't go outside or can't partake in activities. Are there activities that are safe to do outside? I feel like if it's even recommended to kind of get out and get some fresh air and some sunlight.
I am so glad you said that, because it is recommended that you can go outside and you can get some sunlight. You can go on hikes when there's not a lot of people around, so you're not going to be coming in close contact. You can go for a bike ride. You can play field hockey in your backyard and basketball with your brother. What I saw yesterday when I went to the park, my office is right next to Freedom Park, what I saw that is not called social distancing is groups of people playing volleyball and groups of people playing soccer on the fields, or running together in groups of 10, and I almost came out of my office. I was like, that is not social distancing. That is being in summer vacation. So I think if you're outside, go outside. Your brother, you live with your brother, that is fine. But meeting up with your friends to hang out at the park and play sports, that is not social distancing, and that is going to continue the problem.
All right, Vanessa and Dr. Temple, thank you very much. We're going to take a quick break. Coming up, more answers to the top questions circulating on social media. There's so much information out there. We're asking Dr. Temple about symptoms of the flu versus symptoms of the coronavirus. Maybe we're going to even work allergies into this. Her answers coming up after the break. Welcome back. So the coronavirus is something that none of us had really heard of before, but the symptoms are very parallel to the flu. Dr. Anna Maria Temple here to talk about the difference between the coronavirus versus the flu virus. So how can we differentiate these?
That is still difficult. I mean, I love that we have a graphic that helps explain a little bit. The coronavirus is going to be fevers, generally high fevers, cough, shortness of breath, some achiness. The flu is high fevers, cough, sore throat, runny nose, very achy body, just generally unwell feeling.
So these symptoms often mimic allergies as well. So when should someone think that maybe they need to go get a test versus just what they're experiencing from everyday allergies? I mean, this is really hitting at a bad time of year with allergy season kicking in.
It is making it so confusing, but the good news is that in allergies, I mean, if we're going to say it's good news, but in allergies, your eyes are itchy, your eyes are watery, your nose gets itchy, you sneeze a lot, you may have cough, you may have snot and phlegm, but that is a very juicy, productive itchiness. So that, I would say, that's a little easier than the dry cough, because coronavirus has a very dry cough and high fever. So it is a little easier to discern between that and allergies. Still confusing between that and flu.
And just define real quickly a dry cough versus what we would consider a wet cough.
So a dry cough is one that is producing nothing, sounds barky in nature. A juicy cough, I'm always like, sounds like you've been smoking 10-pack years, and when you cough, you just like spit it out. Like my parents to the kids, I'm like, does it sound like you want to tell them to spit it out? And that's a juicy cough.
All right, doctor, thank you very much. The information you've been giving our viewers is just so critical and so essential, and I know, speaking for them, much, much appreciated. Thank you very much.
Thank you so much.